So I'm Dr. Arjun Trivai, as mentioned. Yes. And we are going to discuss 10 myths and facts which you normally encounter every day regarding your kids or yourself as working adults or as for your parents. Okay? Yes. So we'll be covering all age groups in 10 myths and facts. And the health topic will be about why modern humans are forgetting preventive living in this era of fast forwardness. So, a brief introduction about myself. I'm Dr. Arjun Trivai, CMD Mulberry Dental, practicing in Nallaganda. And she's my beautiful wife, Dr. Swati. She also practices in our clinic, and also she's a full-time consultant at Rainbow Hospital just opposite here in Financial District, working as consultant gynecologist nearby. Okay, so our story starts with her, my wife. Okay, so 10 years back, she had a painful wisdom teeth extraction done. So during the procedure, she had only one problem, that was her anxiety. So she's a very good surgeon. She's a very profound surgeon, very competent surgeon. Yes, and also very competent just like you guys. But still, she had an anxiety attack during the procedure. A simple extraction. So I asked her after the procedure, so what happened? Why were you so panicked? So she replied with only one thing: I hate the drill of the sun. I hate the drill of the burr. And I hate dental treatments. So on that day, we discussed that what if the dental treatments were completely painless? What if we could manage that anxiety and that panic attack in everyone? Even I am also afraid of dental treatments. That's why I make sure my hygiene is perfect and I follow everything which I'm going to show you. So back 10 years before, we have established Mulberry Dental and Gynecology Clinic, and since then we have followed the same philosophy of reducing the patient's anxiety. We have got the state-of-the-art sleep gas for the first time in West Hyderabad, which helps even 2-year-olds to relax, even the anxious adults who are very much, who tremble just by hearing a dental clinic name. Yes. And using the same philosophy, we have treated thousands of children who are suffering with early childhood cavities, the modern day child, and who are suffering with snoring even after multiple adenoids or tonsillectomy surgeries, and who are suffering with sleep apnea. Yes, sleep apnea and snoring and tonsillitis and adenoids have become very much common in nowadays kids. So how many of you have kids? Okay, many of you. Okay, done. And we have treated adults too, who are working throughout the night with disrupted circadian rhythms, getting headaches and bite problems, particularly because of working overnight. And we have treated elderly too, thousands of elderly who have suffered with headaches because of the bite problems and joint issues. Just like the knee joint, the same happens with the TMJ joint, which is a small joint present near your ear. So this joint gets disrupted with age and also because of overworking your joint, particularly because of stress or else because of continuous disrupted circadian rhythms, sleeplessness, and disrupted sleep cycle. So regarding the same, today I'll be giving you 10 myths and facts of how to combat that headaches and how to combat the modern day fast forwardness, and how to protect your child and even your parents too. So based on the same philosophy, I have written a book which is Adventures of Mr. Teeth, present on Amazon and widely circulated in many schools as a scholastic book. So international edition is there and also an Indian edition. So briefly we'll be discussing the myths and facts related to different ages, your kids, your parents, and yourself too, as working competent adults. And at the end of the session, we'll be having a 10 minutes question session. If you want, you can definitely ask. So the most common myth is fear, that which I have emphasized, that will my child cry if I take her to a dental checkup? And will I get pain? as anxious adults. So this is the most common myth. And the answer to this is no. The modern behavior modifications, behavior technique modifications and sleep gas and even needleless injections based on our Mulberry dental philosophy have proved very effective in combating anxiety and panic attacks. And our Mulberry mission is based on the same fact that if a child or a parent leaves our clinic with tears, then we deem our treatment as a failure. So coming to first statement, just to engage you all, I'll be having some statements. So you'll need to tell if it's a myth or a fact. Just 10 statements. Okay, first starting with your kids. Many of you have kids, right? I presume? Yes. So 3 will be on kids, 3 will be on yourself, working adults, and 3 will be based on your parents. Yep. Okay, the first one. The first statement is it's okay if milk teeth have cavities, as they are anyways going to fall off. So what do you think? Is it myth or a fact? Fact? Okay. Okay, myth or fact? Myth, how many guys? All right then. Fact, how many of you? Yes, all right then. Okay, so it's a myth. The reason I'll explain to you, because dental cavities are particularly common in the modern generation. The reason I'll explain to you, and they are 10 times more common than common flu in young children. And why do they matter? Because the cavities do spread from, this is the milk teeth and this is the permanent teeth. And this is the milk teeth, this is the permanent teeth. The cavities do spread from milk teeth to permanent teeth in kids. And the back teeth of your young kids will be coming when they are around 14 years. If they are around just 5 years now, 5 years or 4 years. So those back teeth and the other permanent teeth will be coming when they are around 10 to 14 years. The front teeth will be coming when they are around 6 to 8 years. But we have to preserve the back teeth until the permanent teeth erupts. Otherwise, the permanent teeth coming out will come out infected or cavitated. Yes. So it's essential to preserve your milk teeth. And how to do that for your kids, I'll explain to you in the further slides. So stay tuned in. Yes. I'll explain to you how to do that in the further slides. So stay tuned. So statement number 2. Our grandparents, mana tata muttalaki never had cavities. So we too can't get cavities. Is it a myth or a fact? Myth? Okay, then I hear myth everywhere. And it's a myth. Yes, very good. So the reason, number 1 reason is for the children. It's because of the eating with long screen times. Nowadays, my kids also eat with watching TV and watching screen all the time. The food bolus stays in the mouth for a pretty long period of time. So the food gets digested in the mouth. The mouth has something called salivary amylase, which is a digestive enzyme which causes the digestion of the food inside the mouth instead of the stomach because of the long period of the exposure. So mouth becomes acidic in your kids, leading to cavities. Apart from that, the present truth, anywhere you go, any mall you go on your weekend holidays, there'll be a big stand of lollipops or big stand of processed food everywhere. So the processed food and the industrial revolution has altered the genetics of the human saliva. So the IgA, there will be something called IgA antibodies in the human saliva, which naturally protect us from cavities. And sadly, our ancestors had pretty much good amount of antibodies in their mouth, but because of the processed food everywhere and the genetic alteration of the saliva, even if you are not having the processed food, even if your kid is having only healthy food, your kids are even prone to cavities. So what can we do? We obviously can't alter the genetics. The evolution progresses. So what we can do is definitely you can go home and change your kids' dinner plate. Okay? So I'll be giving small tips on how you can change your kids' dinner plate tonight. So it's called a karyostatic diet. Implies a diet which prevents the spread of the cavities. According to National Institute of Nutrition, Hyderabad, 2024 food plate, they suggest on the first month, they suggest at least 150 grams of day of crunchy carrots for kids and 350 grams per day for adults. I'll be giving you diet charts for everyone, for your kids, so that you can go home and explain to your kids too, and even your parents. So month number 1 include a lot of carrots for your kids. Carrots in particular break the something called plaque cycle. Even if you brush or don't brush, there will be something called plaque cycle. Teeth become prone to cavities. So these carrots break that plaque cycle. So once the plaque cycle is broken, you can shift to month number 2 for your kids. So month number 2 and the meals, any meals your kid has or your parents have or yourself have with a small piece of cheese. Cheese is karyostatic, implies it prevents the spread of the cavities. And month number 3 and month number 6, you can follow in the same way. Particularly, there will be something called oyster mushrooms. You can get in Zepto and Blinkit. They have been medically proven to boost something called IgA antibodies, which we have discussed previously, which our grandparents had very much. So we don't have much IgA antibodies in our mouth. So we can definitely boost them with good food, like oil of oyster mushrooms every day on the 6th month. We can follow the same diet cycle. Distribute chest. To prevent cavities, not only in yourself, but even in your kids. It's called a karyostatic diet. Ante puchulu perakonda aape diet anamata. And emi tinakodu. Emi tinalo cheppanu, so emi tinakodu. So juice boxes are worse than chocolates. Chocolates, you can give soft chocolates sometimes to your kids, or you can enjoy yourself. But juice boxes will be having something called citric acid, which is added for the tangy taste, even in your protein powders after gym, or else even in formula milk, there will be something called citric acid. And no lollipops, no sticky chocolates. And jaggery foods and sugarcane contain fructose, which make your kids more prone to cavities. So, anni oddantunnaru, so it doesn't mean you can't enjoy your life. You can enjoy and go on your weekend to DLF Street or enjoy your processed food everywhere. But you have to balance it. Ela balance cheyali, I will be explaining in the future slides. So statement number 3 is also regarding kids only. Mouth breathing, noru terichi padukodam in kids only indicates that my child is too tired. Is it a myth or a fact? Myth. Okay, many of you are saying it's myth. Very good. So that's a myth. So in children, particularly nowadays, the modern day child is prone to multiple allergens because of multiple reasons. So the restriction of the child's airway, it's mainly because of the restriction of the child's airway. When the child's airway is restricted, that is upiri teesukodam kastamainappudu, it may not be evident, but it causes mouth breathing or teeth grinding or bedwetting in children. So restriction of the child's airway can occur at nose, nasopharynx, or at the mouth. Okay? And it's the same reason that why so many kids today are getting adenoids and tonsil surgeries done. You may have seen many of your colleagues or else many of your friends, children getting adenoid and tonsillectomy surgeries. So how can you prevent that? So the modern child is prone to many allergens. So 3 tips you can follow. Tip number 1, you can make sure that you use a HEPA filter vacuum cleaner for your mattress for your kid, and after your kid comes home from school, you can use a salt water gargle, and you can find out any allergens which are there, which are particularly obstructing their nose. Yes, which causes nasal congestion. So why modern day children are more prone to cavities? Because the modern day child eats soft food every day, like idlis every day, particularly during the jaw growth period. And chinnapillalaki, they will be having something called jaw growth. The jaw grows forward, particularly at age of 1 to 10 years. After the 10 years, the 2 parts of the upper jaw fuse for life. So 1 to 10 years is very crucial for your child's growth, for your child's facial development in particular. And the modern day child breathes through the nose, breathes more through the mouth instead of the nose because of continuous allergies undadam, continuous cough undadam, continuous cold undadam. So they breathe more through the mouth. Yes. And because of the same reason that their tongue is always low. I will explain to you. And because of continuously seeing screens, particularly with their head down. So manam even if we sleep at nights with our mobiles on, it doesn't affect us much. Because and it causes heavy forces of around even 1 inch drift down when you drift down to see a mobile, it causes a pressure of around 5 kgs. So, but it doesn't affect us because we are adults. We don't mind keeping a 10 kg 10 kg catapult or 10 kg dumbbell on our neck, just like Peddi. So, but for children, it does matter. For children, what happens is that during that 1 to 10 years age, the jaw will be growing. So when there is continuous force directed forward, the body sends signals that the growth should be like this instead of like this. So there is continuous, if they see mobiles 1 day or 2 day, it's fine. But if there is continuous growth signal that it's directing forward 5 kg, imagine 5 kg in front of your child, directing their growth every day. So the jaws move forward instead of growing like this. So what happens because of that? On top of the upper jaw, you have the nasal floor. So if the upper jaw remains constricted, the nasal floor remains constricted. And when the same child grows up, because of the constricted nasal jaw, they end up with sleep apnea, lot of cases of sleep apnea in kids, and lot of cases of sinusitis or deviated nasal septum in the adults, when the same kid goes up into adults. So what can you do about it? So, and the constriction can also occur at the mouth. So here are 2 simple tips you can follow for your children to prevent this, okay? So one is, make sure whenever they are seeing the mobile and everything, it's at their eye level. And make sure they eat a lot of crunchy foods, particularly like carrots. Chewing stimulates immunity. Chewing stimulates the jaw muscles so that they support the jaw growth properly. And tip number 1 is myofunctional exercises. Myofunctional exercises implies your tongue. This is the tongue. Tongue is like, so you're all software engineers, right? Yes. So tongue is like the architect of your mouth's, of your child face, which shapes the child's face. Okay, so I tell to parents that tongue is like a pole of a tent. If the tongue is up, and do you know which is the home of the tongue? So I tell to parents that the home of your tongue is on the roof of the mouth. So tongue basically supports the roof of the mouth. So if the tongue is upward on the roof of the mouth, that is, if the tongue is home, the airway opens. If the tongue is down, then the airway collapses, leading to deviated nasal septum or sinusitis as the child grows into adult. So make sure you do some exercises for your child which are called myofunctional exercises, just keeping simple exercises, keeping your child's tongue on the roof of the mouth and asking them to open and close, which causes pull of the jaws. And so that the tongue, which is the architect of your child's face, knows its position and it is home. Yes. So, a lot about kids and tonsils and adenoids in kids. You can prevent, here are 4 common mistakes which Indian parents do, which can lead to tonsils or adenoids in their children. So number 1 is stop sharing spoons and cutlery with your kids. Avoid this. Okay, many of the parents do this. So reason is that Streptococcus pyogenes and EBV virus are present in adults in latent stage, adults in carrier state. But in children who don't have enough immunity yet, they can cause immediate tonsils and adenoids. And avoid, many of the Indian parents give only soft mashed food like purees kani, lekapothe only rubbesi ivadam atla, and also small idlis atlantivi. So avoid this. 2 years avangane, you have to stop milk bottles and you have to give crunchy foods, which stimulate the jaw growth. And oral hygiene, you have to make sure their hygiene is good so that the tonsils don't become bigger. Mild tonsillitis is common till 10 years of age, but they should not progress to grade 3. Yes. And ignoring snoring or mouth breathing in kids, avoid this. So children, they should not breathe through the mouth. They should breathe only through the nose. It's a very deep concept. So basically, at 7 to 10 years, make sure you don't miss this golden period of 7 to 10 years. As I explained, after 10 years, the 2 parts of the upper jaw will be fusing for life. 2 parts of the upper jaw implies 2 parts of the nasal floor. So the nasal floor will be packed and it will be stationary after 10 years. After 10 years, only jaws grows like in other ways. Yes. So here are the myofunctional exercises help in the same. Okay, coming to myth number 4. This is regarding you only, all working adults. సో ఎంత గట్టిగా బ్రష్ చేస్తే అంత మంచిది, అండ్ బ్రషింగ్ 4 సార్లు బ్రష్ చేస్తే రోజుకి మంచిది. ఇస్ ఇట్ ఎ మిత్ ఆర్ ఎ ఫ్యాక్ట్? మిత్ ఓన్లీ. ఓకే, డన్. Why I kept is that why I kept this myth is that because I had a funny patient in my clinic who told that she brushes every day 4 times daily, but yet she had around 10 cavities in her mouth. So she was confused. 4 times brushes na enduku cavities vastuni. Her husband was making fun of her, saying 4 saal brush chestha andike nee cavities vachinay ani. Who brushes 4 times per day ani he was making fun of her. So yes, that's a myth. The reason is that brushing twice daily is sufficient, and soft bristle brushing with 45 degrees to the mouth is sufficient. So brush cheyali, but eppudu brush cheyakodu. That is also important. Here are 3 times when you shouldn't brush your teeth or your child's teeth. 1, immediately after your meals. After your meals, your enamel is already deteriorated because of the acidic food we have. All the packaged foods or any processed food will be having acidic, and even any food also. So avoid brushing immediately after meals, and avoid brushing immediately after vomiting if your child pukes, because already their mouth is laden with acids. Yes. And avoid brushing immediately after chocolates or packaged foods. Okay. So after chocolates, all the packaged foods will be having citric acid, which is added for the tangy taste and as a preservative. But this citric acid is different from the citric acid which you find in lemons, or that is naturally balanced, given by God with antioxidants. But this citric acid is added to all packaged foods, even formula milk, even the gym powder which we have. Yeah, so it will make the mouth acidic. So avoid it. And other acidic times are when you have a swim. Avoid brushing immediately after a swim, because the chlorine will be acidic. If you brush immediately after a swim, it will make your teeth more prone to cavities. It's simply about balance. So the next myth number 5 out of 10 is regarding you only, flossing. So anyone flosses their teeth? Very good. So I don't floss regularly, even being a dentist, only on my week offs, to be precise. I floss my teeth. Yes. And do you think it's a myth or a fact? Flossing isn't necessary, because anyways we brush. Okay, fact. Okay, then let's see then. It's a myth. Okay, because brushing only cleans 60% of the tooth surfaces, and most of the interproximal between the teeth, wherever the teeth are there. So wherever the teeth, between the teeth, the saliva doesn't grow there. Saliva has antibodies which protects the teeth. So IgA antibodies, which I told in the previous slides. So there is no saliva between the teeth, so you have to manually do it. And myth number 6 regarding pregnancy. Yes, dental x-rays. So it's a statement basically. So dental x-rays are not indicated during pregnancy. Is it a myth or a fact? Pregnancy lo x-rays తీసుకోకూడదు, dental x-rays. Is it a myth or a fact? Myth? No, it's a fact. Yes. You are true. I'm making the pattern here. So that is it's a fact. So dental x-rays తీసుకోకూడదు, because you have to keep your child and your wife and yourself safe from the x-rays. So modern dental practices include iTerolumina, which detects, which is present in Mulberry Dental and few clinics in Hyderabad, which help in detection of the cavities and hidden infections without the need for an x-ray. Yes. And myth number 7 for all the gym goers. And black coffee. Who all have black coffee in the morning? Okay, who all go to gym every day? Gym every day. That's it? Okay. Okay then. So your black coffee and your gym protein don't have sugars. So, and they are safe for your teeth. Is it a myth or a fact? వాటిలో షుగర్ లేదు కదా, సో దే ఆర్ సేఫ్ ఫర్ అవర్ టీత్. ఇస్ ఇట్ ఎ మిత్ ఆర్ ఎ ఫ్యాక్ట్? Myth or fact? Myth, how many of you myth? Okay, how many of you fact? Okay, done. It's a myth, yeah. Yes. So, black coffee, your favorite tea and coffee are acidic, and also your favorite gym powder, as I told you, will be having, it's a packaged food, so it will be having something called citric acid, which is added in multiple formats, which will be making your mouth acidic. So here's a simple tip. After your favorite black coffee at desk or else protein shake after gym, you can simply balance your mouth's pH by having high pH foods. Simple high pH foods which you can have are watermelon is high pH, muskmelon is high pH, soaked almonds are high pH. So you can have, after your favorite black coffee, you can have some almonds to naturally balance. After your protein shake at gym, you can have some cucumbers to naturally balance. But these are all high pH foods even after a swim. The chlorine makes your mouth acidic, so you can have high pH foods. Even kids who continuously breathe through the mouth, who have tonsillitis, they have dry mouth. Dry mouth in the sense acidic mouth. So after 6 p.m, for those kids who have tonsillitis and adenoiditis, you can give high pH foods and no milk after 6 p.m. for kids. And myth number 8, 8 out of 10. So mouthwash is critical after every meal. Every meal tawata chesukovalsinde mouthwash, and it protects your teeth. Is it a myth or a fact? Okay, how many of you myth? All right then. Okay, how many of you fact? All right. Let's check then. It's a myth. Yes. So, so doing mouthwash immediately after you brush can do more harm than good. So after a meal, the mouth is laden with acidic food, acidic bolus, so which makes the enamel softer. The same reason, and is the same reason for yellowing of the teeth in our parents. And in parents, it matters more because the mouthwash destroys the good bacteria in the mouth. So the good bacteria in the mouth, basically when you have ABC juice, your favorite ABC juice, the good bacteria in the mouth convert that into nitrous oxide, which will help in regulating the body's blood pressure and also sugar also. So it's called a nitrous oxide pathway. Okay. So this good bacteria is disrupted with continuous use of mouthwashes every day. Particularly if your parents are using mouthwashes every day, ask them not to do, because it will be causing high blood pressures in particularly senior citizens. Our young age is particularly not prone, because of the less bacteria in the elder adults. Avoid doing this for your parents. And this is also regarding your parents. Myth number 9 out of 10. Statement, yeah. Moving teeth is normal part of aging in your parents. Is it a myth or a fact? Moving teeth kaladam.
It's a fact. At that stage,
Yeah.
obviously the teeth.
Yeah, how many myth? Manam kuda, we also age. Okay, how many fact? All right then. Let's check. Yes, it's a fact. Yes, yes. Very good, very good. Yeah, that's a fact. But many adults lose teeth not because of age, but because of the hidden gum and bite problems. So having a regular dental checkup for your parents with advanced scans like iTero scans, which is present in Mulberry Dental also in few clinics in Hyderabad, helps in detecting gum diseases and hidden infections at an early stage. Yes. And even latest advances will include a smile simulation for your parents, which you can show to your parents a initial smile followed by a final smile even before the start of the treatment. And this is the final smile. Yes. And last myth regarding your parents only. teeth anta arigipotha untayi kada. Yeah. So tooth wear happens only because we are getting older. Teeth arigipovam basically. Arigipovam, crack ayiporam. You may have heard your parents saying teeth arigipothunnayi. Yes. So it happens only because we are getting older. Is it a myth or a fact? Myth. How many of you myth? All right, everyone almost. It's a fact. Are you positive? Yeah, very good. I like the spirit of your team. You have a very good, energetic team there. All credit goes to ma'am then. Yes, it's a fact only. Yes, but just like I explained to you, just like manaki pedawalaki mokal etlaithe arigipotayo, this joint, which is a small joint present in your ear, it's called a TMJ joint, which silently controls your jaws. And a healthy jaw will indicate a healthy teeth. దీని మీద ఎక్కువ ఫోర్సెస్ పడడం లేకపోతే ఇది జా పెద్దవాళ్ళు ఏంటంటే ఇది అరిగిపోతూ ఉంటుంది అండ్ దానివల్ల మనకి టీత్ క్రాక్ అవ్వడం ప్లస్ టీత్ కిందకి జారిపోవడం జాస్ అంతా కిందకి చిగుర్లు కిందకి జారిపోవడం అవుతుంటుంది అనమాట అండ్ ఈవెన్ ఇన్ adults, young adults like you who work overnight, sometimes when you work overnight every day after till 1 p.m. or 2 p.m., then also there will be continuous forces on your joint which causes pain in the muscles. Initially it starts as pain in your, it's called masseter myalgia, or else it may simulate migraines. Migraines laga anipistadi, but it's not migraine. The difference between migraine and this pain is that in working young adults is that migraine lo endante it's a neurological pain. So manaki itla press cheste podu migraine perugutadi. Deentlo endante it's muscle pain. Ee joint ki attach ayina muscles. So if you press the muscle, the pain goes off. So that's an indication you can do at home. If it's migraine or is because of the disrupted circadian sleep cycle. And for your parents, you can do simple jaw exercises. You can make them do to make sure this jaw stays healthy. Mokal etlaithe healthy undalo. This joint also for your parents should stay healthy to prevent them from cracking teeth. So simple exercises which you can do also. Fist resistance, just yes, you're doing right. Fist resistance and chin resistance from the side, both sides. Yes, and opening and closing with your tongue up. Tongue should be always home. This is the home of the tongue. Home of the tongue is on the roof of the mouth. Open and close, and gently moving your jaw forward and backward, and opening up your lips like this. If you have any breathing problems, if you do like this, if the breath improves, then you have little congestion in the upper jaw, or else congestion in the nasal floor. So these exercises you can make your parents do so that their knee joints are as safe as their temporomandibular joint. And for your parents, I will definitely suggest Senqualef toothpaste if they are having cracked teeth or else sensitivity in the teeth, because many patients have given Senqualef, and because it remineralizes the enamel and reduces the cracks in the teeth. So they have found tremendous results even after 1 day of using it. So for your parents, you can definitely give Senqualef toothpaste. Some samples are there. You can use them. For your parents, you can take for your parents. And for yourself, I will definitely suggest Vantage Forte, which is a pro-enamel toothpaste which will reinforce the enamel for your teeth for young adults. And this is for your parents. For your kids, I'll definitely suggest Cheerio Plus. Any xylitol-based toothpaste is anti-cavity for kids. So you can definitely use anti-cavity toothpaste like Cheerio Plus for your little kids. If your kid is below 3 years or 2 years like that, avoid toothpaste, and you can use some casein peptide like GC Tooth Mousse, which will be available in Amazon. If your child continuously thinners on the toothpaste, instead of brushing, if he continuously eats it up. Yeah. So doing this will make sure that your kids and your parents have healthy smiles. If your kids and parents have healthy smiles, then you'll be able to work more passionately at Dextera with extra hours and reach your goals. So happy smiles for a healthy lifetime. Okay, yes. So this is me signing off, Dr. Arjun Tiruvai from Mulberry Dental, and this is our Instagram page. If you want more such tips, we constantly update with Praveen here. He'll be shooting reels for us, which help us deliver more common tips to general public of multiple ages. Yes, so you can scan this if you want to follow our Instagram page.